when it comes to treating an eating disorder, there are a bunch of factors we have to consider. First of all, we always want someone to get a full assessment to be sure they don't need any kind of a medical stabilization, because these are very serious illnesses. They're life-threatening, and they have very serious medical consequences. So one thing is that at the outset, we want to make sure someone doesn't need hospitalization to stabilize them. And if they do, that can be pretty short-term. Obviously, could be long-term, but usually it's pretty short-term, just a couple weeks or something like that. So then once we have an assessment, we can recommend a level of care. And usually we start with outpatient treatment because we want the least restrictive setting for anybody. That way they can stay in their lives, they can, stay in school or a job, and the eating disorder treatment can be applied to their everyday life, which is obviously the best case scenario. So then once we get them we make sure someone's medically stable and we get them into the level of care they need, hopefully outpatient treatment, then we look to have a multidisciplinary approach to treatment. So that includes a medical provider to keep track of labs and vitals and stuff like that, any kind of medical complications that could be happening, either as a result of the eating disorder or as a result of the treatment for the eating disorder, which can happen as well. So then we also want a dietitian on board who can help restore nutrition to the body and brain and help someone to gradually expand their variety and also take in the amount of food they actually really need every day, and not to be over-exercising at the same time. And then we have a therapist on board to work on tolerating treatment, because often with eating disorders there's a lot of ambivalence about recovery, and so it is the kind of goal of the team, the treatment team, to hold hope for that client, make sure they know that full recovery is possible and that it is the goal of everybody on board, and to help them find the best treatment for them that is evidence-based. Cognitive behavioral therapy is the most common treatment for an eating disorder, and is based on thoughts and behaviors. Family-based therapy is also a very effective treatment for an eating disorder, and it makes the family the kind of place for treatment and puts the family in charge, helps the family to kind of support and motivate the person with the eating disorder, and actually just really help them recover as well. Interpersonal therapy is another therapy that can be also very effective, especially with binge eating disorder and sometimes with bulimia as well. There are other treatments that work, but those are the three that have the strongest evidence base behind them.